Throughout the COVID-19 pandemic, and our gradual reopening process, the Maine CDC has monitored epidemiological data such as case trends and new hospitalization rates, as well as healthcare readiness and capacity to inform our decisions on lifting any restrictions. We review those metrics in their totality and in context, as opposed to the daily change of a single metric itself, of course. This includes taking into account the insight of Maine CDC epidemiologists. For example, whether an increase in cases is related to an outbreak in a congregate living facility or to spread among close contacts of a previous positive case. So what do these trends look like? Maine has seen an increase in hospitalizations related to COVID-19, as well as an increase in case counts, particularly in York, Cumberland, and Androscoggin counties. In light of those trends, today my administration is postponing the reopening of restaurants for dine-in service for those 3 counties in particular. Restaurants in those counties were tentatively scheduled to reopen to dine-in services on June 1, stage 2 of our reopening plan. Instead, they may now offer outside dining service beginning June 1, but not dine-in eating. We believe this change is safer for the health of Maine people and that it balances the economic needs of these businesses with the priority health care of Maine people. I know this is not welcome news for those restaurants who've been preparing to fully reopen next week. It is our hope that by reopening for outdoor dining and curbside pickup and takeout, that we can still protect the public health and perhaps lessen the economic hardship that these businesses are enduring. I've also asked the Department of Health and Human Services and the Department of Administrative and Financial Services, both of which have licensing authority for restaurants. I've asked them to streamline and expedite licensing to facilitate the transition to outside dining, and they have done this. Streamlined permit options are available on the licensing sites. Additionally, the Department of Economic and Community Development today will be updating its restaurant guidance for outdoor seating. We will continue to evaluate the data trends and share a new reopening date for dine-in services in the coming weeks. In the meantime, I encourage the municipalities in Androscoggin, Cumberland, and York counties to consider closing some of their streets, as the city of Portland and some other cities have done, and free up space for restaurants to serve outside in a safer manner. Other than this change, we do expect stage 2 to move ahead as planned. This means that retail businesses in York, Cumberland, Androscoggin, and Penobscot counties may reopen if they wish, with added health and safety precautions, such as restricting the number of customers in a store at one time, enhancing cleaning practices, using touch-free transactions, and strongly encouraging customers to wear masks. It also means that restaurants in Penobscot County may reopen for both dine-in and outdoor dining with added health and safety precautions, including physical distancing the customers, ensuring that employees follow enhanced hygiene and sanitation practices, controlling customer flow through making reservations whenever possible. We believe it's appropriate to allow Penobscot County to join the 12 rural counties in reopening these establishments, given that the county has not had more than 3 cases a day since April. So as of June 1, statewide, with new health and safety precautions, Maine people can go inside a retail store, keeping a distance from others. You can go to a drive-in movie theater. You can golf, hunt, fish, boat, camp, get a haircut, take a dog to the groomer, or take an outdoor fitness class, among many other things. And as of June 1, if you live in Aroostook, Piscataquis, Washington, Hancock, Somerset, Franklin, Oxford, Kennebec, Waldo, Knox, Lincoln, Penobscot, and Saginaw counties. That's a mouthful. You can also eat at a restaurant indoors or outdoors with safe distancing practices. That's 13 counties. If you live in Androscoggin, York, or Cumberland County, you can enjoy outside dining at the restaurants who choose to open. As I've said from the beginning, every day we monitor epidemiological data and emerging science and the experience of other states, and when necessary, we will adjust the reopening plan as we did today to protect the health of Maine people. State government will work to protect you as well. That's why we have more than tripled the state's testing capacity through our agreement with IDEX, and we're working every day to secure more capacity. It's why we have eliminated the testing prioritization system so that anyone suspected of having COVID-19 can be tested if their doctor thinks it's appropriate. It's why we're recommending universal testing in congregate living situations after a single confirmed case. It's why we're expanding the state's contact tracing system, as Commissioner Lambrou described yesterday. And we've announced the deployment of federal funds to expand the state's lab capacity, to bolster rural hospital lab capacity, and to establish drive-through testing sites. Tomorrow marks almost 3 months since the first reported case of COVID-19 here in Maine. 3 months ago, seemingly overnight, a pandemic changed our state in a way we could never have imagined. Since then, Maine people have changed too. Distillers are making hand sanitizer, and sneaker companies are manufacturing cloth face coverings. Restaurants are serving to-go cocktails and delivering free meals to those who need them. Schools are sending tablets home, and teachers are connecting with students over Zoom. The Department of Education is using federal funds and private donations to secure internet access and provide internet devices to help with home learning for 100% of the Maine children who said they needed it. At the same time, we hug less and we wear masks more. You, the Maine people, have adapted your way of living, working, and having fun to keep yourself and others safe. We need to keep doing this because, make no mistake, the virus is still among us, and there are risks associated with almost everything we do. But whatever challenge comes our way in the next 3 months, we have shown that we can rise to meet it. So I ask you again, please remember to wash your hands frequently, 20 seconds at a time. Maintain 6 feet distance between you and others. Stay home when you can, especially if you're older or if you have a health condition or a member of your family does. And wear a cloth face mask, a covering, when you're out in public to protect others. Stay local, shop local, support your local businesses whenever possible. We're all in this together, and we continue to be in this together. As Dr. Anthony Fauci said earlier this week, quote, "Now is the time, if ever there was one, for us to care selflessly about one another." I couldn't agree more. Thank you.